How you use your inhalers can affect your asthma symptoms. If you aren't using them properly, the medicine may not be getting into your lungs where it needs to go. If this happens, you may not be able to keep your asthma symptoms under control. I will give you some tips to help you make sure you are using your inhaler properly. Keep these in mind every time you take your medicine. There are different types of inhalers, and it is important for you to know how to use the inhalers you have. Common inhaler types include metered dose inhalers, dry powder inhalers, and breath-actuated inhalers. First, know if and when to prime your inhaler. Some inhalers have to be primed when you first open them, and some need to be primed before each use. Make sure you know if and when your inhaler needs to be primed. The prescribing pamphlet that comes with your medicine should have this information. Make sure your inhaler is not empty. Check the counter. If your inhaler does not have a counter, you will need to keep track of the doses left by counting how many puffs you take. Stand or sit up straight. This allows your lungs to fully breathe in and out. Keep your head at normal levels straight ahead, not bent forward or backward. This will help the medicine get through your airways and not end up in the back of your throat. If you have a metered dose inhaler, shake it well. Attach a spacer or valved holding chamber to it. This adds space between your mouth and the inhaler. This lets the medicine break into smaller droplets so you can inhale more. Dry powder inhalers and breath-actuated inhalers do not need to be shaken and do not need spacers or chambers. Exhale fully before you put the device in your mouth. Don't blow into the spacer or inhaler. Place the device between your teeth and above your tongue. Make sure your tongue is not blocking it. Close your lips around the device. If you have a metered dose inhaler, press down on the inhaler canister and then breathe in deeply and slowly. If you have a dry powder inhaler or a breath-actuated inhaler, there is nothing to press on the inhaler. Just inhale a breath in and it triggers the medicine to dispense. Hold your breath for 10 seconds and then exhale slowly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Repeat if your doctor has prescribed more puffs. Wipe off your device and replace the cover or close it. Depending on which medicine you just inhaled, you may need to rinse your mouth with water and then spit it out to prevent thrush or sores in your mouth. Check the patient information that comes with your prescription. Some of these steps may vary depending on your device and medicine. Use AFA's handouts on how to use different types of inhalers to find out more details about how to use the type you have.